Many years ago, at the turn of the last century, there were two babies born in Upstream Town, twins named Sister Public Health and Brother Planning. Like many twins, they were very attuned to each other's needs and were very loyal to each other. When they were quite young, Sister Public Health became deathly ill with diarrhea and wasn't expected to live. But Brother Planning could not stand the thought of life without his sister, and in the tradition of any self-respecting young child, began asking questions of everyone he could find. Why is she sick? Because she's got a bad infection. But why does she have a bad infection? Because she drank dirty water. Why did she drink dirty water? Because there are no bathrooms and all the sewage runs into the street where the water is. Well, why doesn't somebody do something about that? At that point in the questioning, all the adults would get frustrated and just turn around and walk away. So Brother Planning decided he'd just have to do something about it himself, so that other children would not have to watch their siblings suffer. He carefully took out his blocks and tinker toys and tools and began designing a neighborhood with healthy housing and clean water and sewage systems and all manner of wonderful things. His sister Public Health survived, thanks to the help of some nice nurses who came to visit her and took care of her while she was sick. And once she was well, she was overjoyed that all her other brothers and sisters and friends didn't get sick like her, due to the wonderful inventions of her brother Planning. As the twins grew older, they began working together on other projects to save their friends and families from the suffering caused by the infections that are spread when people don't have clean, healthy places to live or work. During the Great Depression, they even took a trip to New Mexico, where they were able to use money from the government, a special program called WPA, to help wipe out malaria in Rio Arriba, Mora, Santa Fe, Sierra, and Doña Anta counties by draining the swampy lands along the Rio Grande to make them suitable for farming, and not suitable for mosquitoes. They had great fun with that project, but they were even more excited given that Sister Public Health's own childhood diarrhea experience when they got help with the WPA Sanitary Privy Project that built thousands and thousands of healthy outhouses to improve the sanitation in thousands of homes that prevented many children from dying from diarrhea caused by infections. Sister Public Health and Brother Planning had lots of fun doing other things like designing better roads so that people wouldn't die in accidents so much, and things like that. But then, as often happens with siblings, they started growing apart. They didn't hang out together as much, and they each started developing their own interests. Sister Public Health got really fascinated in the new wonders of medicine, things like antibiotics and vaccines. Now, as she grew older, it seemed like there were less and less of those pesky infectious diseases killing people, but she noticed that there were a lot more people who were sick from things they didn't actually catch from other people. And once they got sick, it lasted a very long time, sometimes the rest of their whole life. So even if people were living longer, they were living sicker. So Sister Public Health started trying to figure out ways to convince people that they needed to change their behavior so they wouldn't get sick, like eating fruits and vegetables more than fast food and getting lots of exercise. But one day she followed some of the sick people home and realized they couldn't eat the good food she kept telling them to eat because they didn't have enough money. And instead of grocery stores, their neighborhoods were filled with fast food and mini marts. And she also noticed that when she followed them home, that the neighborhood was run down and dreary with not a park in sight and no kids playing, and she almost got hit by the speeding cars since there was no sidewalk, and it made her never want to walk there again. And even though Sister Public Health did manage to help some people, more and more kept knocking on her door every day, showing up with diseases like diabetes and dropping dead from heart attacks right there on her doorstep. She thought she just needed to work harder to change people's behavior, but the problems just kept getting worse. She was very frustrated and sad, but it didn't occur to her to go ask her twin brother Planning for help, since he had meanwhile become quite enamored of superhighways and fancy housing developments with shopping malls out in the suburbs. He was so busy and making some money that he didn't have time to think about Sister Public Health or really care much about what was making her so sad. But the story doesn't end there. Yay! The twins got invited to a family reunion being held by their cousin Policy, where their grandmother Great Streets reminisced about how much healthier and happier people had been in those old neighborhoods before the fancy suburbs that Brother Planning had helped design. When kids could walk or ride their bikes to school, and people traded odd jobs for fresh fruits and vegetables, and the families could eat together almost every night because the moms and dads didn't have to work 2 jobs each to make enough money to pay the rent. Grandma Great Streets got pretty choked up remembering all this. Sister Public Health and Brother Planning suddenly realized how much they missed each other and how powerful they felt as a team when they were young. They got so excited about the possibilities that they started working together again, thinking about how things were done in Upstream Town. Like everybody of all colors of the rainbow working together to make happy neighborhoods, and parks to play in, and farmers markets to get yummy food, and good jobs too. And even though it was really hard work, they decided to build themselves a new house together in that little upstream town where they were born, bringing new joy and hope back into their lives and the lives of all they touched. So, what is the moral of the story? Communities are designed by choice. We need to make the healthy choice the easy choice because place matters.